Seeking my blessings from Swamiji, our chief guest, Honorable Shri Dinesh Gunduraju. We had our guest of honor, Mr. Ajit, who just excused himself. Cadabam's Distinguished Psychiatrist 2025 awardees. Cadabam's Mental Health Professional 2025 Bright Star awardees. My colleagues, better known as Cadabam's family, doctors, mental health professionals, leadership of Cadabam's groups and the associated group companies. It's indeed a proud honor to stand before each one of you all and announce the launch of Cadabam's Hospitals, Whitefield. I'm sure the video was enticing enough that you still get glimpses of it, but we'll sure host each one of you all in the facility. Being an August gathering of this sort, on an occasion, we said we will unveil it here. I know it's been a long wait, a wait that has taken a few months and ran into a lot of patience. All I can say is we have powered up right now. So we are ready with Cadabam's Hospitals, Whitefield. This long wait made me realize, and as the elders say, factor in some time and take learnings each time. And so that's what I think I would live with. Many of you all, as I understand, many of you all being our well-wishers, consultants, mental health professionals, you know the work that we do at Cadabam's group. But it's my mere duty to let you know and in how we build everything that we have been building and what we continue to build out. Firstly, about the Cadabam's Hospitals. The first Cadabam's Hospitals that we launched was back in 2014. And we took another 8 years to launch the next hospitals and the healthcare center in Hyderabad. And it took us another 2 years to launch our hospital in Whitefield. What gives me pride and immense joy is to say this is our 38th healthcare center. And last 2 years has been adventurous. But it doesn't stop there. While this is our 38th healthcare center, we are on the road to launch 5 more will launch in the first week of November. So that's really where the roadmap of Cadabam's group lies. I had the opportunity to discuss with the Honorable Minister the complexity that involves with mental health. Mental health is a space that demands clinical, professional, social, legal, and the familial support. There's a 4 vertical to everything that we approach. And when we start to build out facilities, it has not been an easy run. The first psychiatric hospital as a specialty one that we went back a decade back, it was a journey in itself. But right now, what we've unveiled in front of you is a facility that has dedicated psychiatric emergency services and its management, with a dedicated space for psychiatric intensive care services as well. Now we understand when we manage it on our same floors, what our clinicians and professionals go through. We've gone on to explore, and I think this space is going to go on to explore, is to do with our neuromodulation services. But the core of everything is our clinical services that comes out of the clinicians as consultant psychiatrists, clinical psychologists, psychiatric social workers, counselors, family therapists, nurses, physicians, care assistants, care attendants, and so on. We've also ensured that there is a very private and a comfortable space. This is gone through its course of learning, where we realize those short stays when individuals face mere challenges and their immediate families need those conducive spaces that one could express. This is all where I could sum up Kadabam's hospitals for you. I hope I've made it interesting enough for you all to drop by when you're around Whitefield the next time. So this is Kadabam's hospitals, Whitefield, for each one of you all. I'll spend a few moments to run you all what you can expect in Kadabam's as the months go by, years go by. As I lead the leadership at Kadabam's group today, of course with the founding values of my parents, my dad, my mom, and Miss Saraswati, I think they've made things a lot easier for us. They took the hardship, they fought the hurdle, and there it comes. Today I'm blessed with a very strong team, each one's dedicated in their core areas and focus. Kadabam's group is no more only in behavioral health and mental health that plays a pivotal, but we have moved on and expanded into the core values of physical health rehabilitation, neuro rehab. We've, as Physiotattva, as many of you all know it, and we've moved on and also explored the space of diagnostics with Kadabam's diagnostics. And the promising space in diagnostics today is imaging used in one way to where it will shape up preventive and promotive mental health is extremely promising. And I'm sure Dr. Shreyas, Dr. Pradeep, and Dr. Divya, who have moved us into the space, will explore this in many folds. And they're already on their fourth center, the fifth one's around the corner. Our physical health rehabilitation and neuro rehab, which Dr. Anup and his team at Physiotattva, we are due to launch our neuro rehab by the year end. And to sum up, our space and work that we've gotten into the final vertical is senior care, home care, as care by Kadabam's, along with Sham and Naufal and the team there. This is one promising space. We already serve in 150 homes, and we're ready to launch 143 senior living homes, and we are there in the community. And our promise is to get to 500 homes to 1,000 homes as we go along. This year, with our commitment in education, has been extremely rewarding and promising. And I should due regards to S. Vyasa University, where we are the academic partners, the industry partners with the academic framework of S. Vyasa University for the courses that we have. We have our faculty research. This is another promising space that we are investing into. Last but not the least, there is one statement that says, there's a legacy of care, a legacy of well-being, a legacy that our founding members, and especially Mr. Ramesh, tells each one of us, make sure it is accessible. And that has driven us to innovation. And this last couple of years has been our focus and investment that has gone into technology. We are ensuring in every step that we can take with AI in mental health, with access, as enabling a universal ecosystem for technology, what we call it as our healthcare operating system, is the next space that we've invested into. So I hope the next event that my dad makes sure that we organize every year, we should be at another landmark event of healthcare centers. With each one of your blessings and wishes, here's Sandesh Cadabam signing off. Thank you very much for your kind attention.
Kadabam's group